Hello, my name is Sampriti Muthuswamy and I go to Oakton High School. Today, I'll be presenting about faith and healing, religion's role in global mental health care. The date today is July 16th, 2024. So here's a little introduction about myself. I'm a rising senior at Oakton High School and I live in Herndon, Virginia. One of my favorite activities is running. I have run 3 half marathons and my first full marathon was last year. I was involved in my school's cross country team for 2 years and I currently lead the Technology Students Association as chapter president. Last summer, I researched about epigenetics and wrote a review paper on the potential mechanisms of transgenerational epigenetic inheritance. This summer, I continue to explore my interest in epigenetics through my internship at Lombardi Cancer Center in Georgetown University. Through this internship, I am researching the role of epigenetics in cancer treatment and prevention. But my passion for science and healthcare extends beyond research. I'm also an EMT and I volunteer at a local hospital. My future aspirations include going into engineering and then eventually becoming a physician. So, to start off, what is mental health? The CDC defines mental health as emotional, psychological, and social well being. It can affect the way we think, feel, and act, dictating our day to day functioning. Now, globally, mental health issues are a significant concern. In 2019, 970 million people were living with a mental disorder. Despite the global recognition of mental health's importance, there are significant disparities in mental health care, especially in developing countries. So let's take a look at South Africa, India, and Guatemala, for example. 30% of the population in South Africa have mental health issues, yet the treatment gap is nearly 92%, meaning that the majority of these people are not getting the care that they need. South Africa has high levels of poverty and violence, which contribute to the mental health issues. But mental health services are often centralized in urban areas, leaving the rural populations of South Africa underserved. Now, India accounts for 15% of the global mental, neurological, and substance abuse disorders. This is a significant number, yet the treatment gap is still very high. This can be attributed to the cultural stigma around receiving help and the lack of resources. Guatemala is estimated to have one of the highest treatment gaps of 97%. Yet less than 1% of the money allocated for public health spending is actually spent on mental health care services. So we can see that these disparities create significant barriers to accessing mental health care services, leaving many individuals without the care that they need. So this brings the question, how does the involvement of religion impact the accessibility and effectiveness of mental health care? In developing countries where there are limited resources, socioeconomic barriers, and inadequate infrastructure, religion plays a huge role in filling the gap. Many mental health resources are not readily available across the globe, and even if they are, people don't access them due to cultural stigma around receiving help or because they can't afford it at all. Because of these reasons, people often turn to religious clergy, traditional healers, or the religious community in general. Religious care is seen as more socially acceptable compared to receiving medical care for mental health issues. For example, a study found that in South Africa, 41% of patients prefer traditional healers because of their cultural, spiritual, and religious beliefs. Now, religious care can offer emotional support, counseling, and a sense of community. Studies have found that it can provide immediate emotional relief and foster a sense of belonging. So, these religious interventions can be beneficial in providing support where formal mental health services are lacking. But how helpful is this religious care? A lot of spiritual and religious leaders lack the formal training to offer actual counseling to people. Studies have found that religious care isn't as effective on its own. For example, a study done in northern India found that although 88% of patients with mental disorders consulted faith healers, only 2% of them reported any improvement. Now, sometimes religious care can create more stigma around mental health. Some religions view mental illness as a spiritual problem, not as an actual medical problem. This can lead to patients believing that their mental health issues are a result of a lack of faith. It was found that there was an increase in the prevalence of anxiety as a result of the induction of guilt and fear among religious patients. Furthermore, religious care can conflict with medical treatment. A study done by Dr. Nakash found that religious patients have a greater distrust towards the healthcare system and were more concerned about the social stigma around seeking help. Some religious patients believed that they could treat themselves through prayer and ritual alone, leading them to delay or not seek treatment at all. So I was interested in seeing how religious someone was and how that impacted their view of mental health care. Through a year-long project, I researched how religious Hindu adults were and how that impacted their perceptions of mental health and mental health care. Although my study solely focused on Hinduism, its results lined up with other similar studies looking at different religions across the world. My study participants included three Hindu adults, mental health professionals, and clergy. They all took the centrality of religiosity scale index, which allowed me to measure how religious they were and assign a religious score to them. And then I conducted an interview with them to understand their perceptions of mental health care, and I used an axial coding format to understand and figure out my results from that interview. As expected, the more religious someone was, the more positively they viewed religious mental health care. But I also found that Hindu clergy saw the importance of reaching out to mental health professionals and getting both types of care. The Hindu mental health professionals talked about how important it was to incorporate people's religious beliefs into their regular professional mental health care because it can help improve their outcomes. So, although religious care does have its drawbacks, it still plays a vital role in mental health care, especially in underserved communities. Because the treatment gap still persists today, we can utilize the existing religious care to better serve individuals. We can do this by providing adequate care training for religious leaders, such as basic mental health education, identification of common issues, and appropriate referral practices. We also need to increase the collaboration between religious institutions and mental health professionals to reduce the stigma around receiving medical care and using religious practices in professional care. Last but not least, it is important to train mental health professionals in cultural competency and sensitivity to religious beliefs. This integrated approach will not only address the immediate needs of individuals with mental health issues, but will also contribute to a more comprehensive and culturally sensitive mental health care strategy, taking into consideration people's belief systems. By advocating for these changes, we can work towards reducing the treatment gap and improving mental health outcomes worldwide. Thank you for listening. Here are my references. And I would like to acknowledge my AP research teacher, Mr. Waxman, who helped me throughout my research project. Here's my contact information, and thank you so much for listening.